The highest number of Mpox cases have been registered in KwaZulu-Natal, and to discuss the province's approach to curbing further spread, we are now joined by Dr. Sandile Tshabalala from the KZN Health Department. Doc, a very good afternoon to you. Thanks very much for your time. 13 cases in all, 2 deaths. It doesn't sound like a lot. Should that be the attitude?
Good afternoon to yourself and good afternoon to the viewers of your program. We are saying 13 patients that have been diagnosed, but that does not mean the total number of people who still exhibit the symptoms are 13. It means people who have been confirmed by all the means of the test are 13 in the country, but some that had their time, the 2 to 4 weeks period, are now better off. So the number of people who are sick in terms of the virus are less than that. I may not be able to calculate that. But the fact that 2 have died out of it, and we are worried any death from something that we should have been able to prevent, does worry us. But there is no reason for anybody to panic. That's how I would want to advise the community.
Remind us again of how we can, as you say, try and prevent.
Remember, the spread is through contact. Therefore, the washing of hands, that old adage of prevention is better than cure is very important. That washing of hands, that sanitizing, that making sure that if you come into contact with fluids of another person or of these animals that are known to be positive or spreading this in a zoonotic way, you need to also clean yourself. That is the basic thing that we need to do. But also, when you find that you've got symptoms that you suspect may be because of this virus, you then need to go to the nearest clinic, get yourself checked. It may be Mpox, it may be another infection, bacterial or viral, but the best thing is that let's be preventive in our approach, whether we have the symptoms or we don't have them. If you are a contact of a person who has been diagnosed, yourself, present yourself so that we monitor you. Should symptoms start, we know how to treat you so that there'll be no complications, and therefore no need for us to be worrying about more vaccines and more other deaths that we may see as a country.
From what we heard, the departmental spokesperson speaking there earlier, treatment is not easily available. Is that cause for concern?
It is cause for concern, but we're not very much concerned for 2 reasons. The Mpox infection is a self-limiting infection in cases where you make sure your immune system is improving or is improved. Whatever the illness you have, he speaks of HIV, diabetes, and all the others. If those illnesses are well controlled, it is unlikely that you may die from the disease. But also, we are saying generally it is a self-limiting disease. Therefore, we should be concerned because we don't as yet have a clear reason and clear source of this infection. So those are the concerns we are having as healthcare workers, but we are trying to follow up on all the contacts that we are having.
Mm-hmm. What are the chances, or is there a likelihood that this could be bigger?
If you listen to Mohale, he speaks of the disease being endemic or the disease being non-endemic. In our country, at the moment, it is not an endemic disease. But also the fact that we've started to manage it, chances of it getting bigger are very slim. And that will be improved by cooperation or partnership of the community with the government, so that should cases be found, we manage them swiftly and we prevent the spread. So if we can start that partnership, the chances of it being very, very much spreading in the country are very slim.
What are the ideal elements of that partnership?
The ideal elements, firstly, if I, Sandile, have been infected, I should be able to give you a truthful information as to where did I travel, how do I think I contracted it, who are my contacts, and we then, as the Department of Health, we then trace these contacts, we monitor these contacts, and the cooperation, which is the second now partnership, the cooperation of these contacts in terms of us checking them, but also them reporting should they find other symptoms that they don't understand. That will assist us in making sure that this doesn't spread. But also that thing that we spoke about initially of the old adage of prevention is better than cure, washing hands, having that monitoring of our own self, and even isolating ourselves should we be having the symptoms, are the parts that can be played by the community. So when we say partnership, those are the issues we're speaking to.
Dr. Tshabalala, thank you very much for your time. Really appreciate it.